Good afternoon, ladies and gentlemen. Thank you for joining us for the 2016 commencement ceremony. I'm Dr. Jia Zhang, Dean of the School of Biomedical Informatics at the University of Texas Health Science Center at Houston. I'm honored to welcome our graduates, their family and friends, our faculty and staff, and our various guests. I want to thank each of you for celebrating with us on this important day. To begin, I would like to introduce the individuals who are participating in this afternoon ceremony. I would ask that each person stand as he or she is introduced. Please hold your applause until everyone has been introduced. Dr. John Halamka, Chief Information Officer of the Beth Israel Deaconess System and the International Healthcare Innovation Professor at Harvard Medical School. Dr. Giuseppe Colasoto, President, the University of Texas Health Science Center at Houston. Dr. George Stanso, Executive Vice President of Academic and Research Affairs, the University of Texas Health Science Center at Houston. Dr. Mike Blackburn, Chief Academic Officer, the University of Texas Health Science Center at Houston, and the Dean of UTHealth Graduate School of Biomedical Sciences. Dr. Susan Fenton, Associate Dean for Academic Affairs, School of Biomedical Informatics. Dr. Elmer Bernstein, Associate Dean for Research, School of Biomedical Informatics. Dr. Robert Murphy, Associate Dean for Applied Informatics, School of Biomedical Informatics. Mr. Ryan Bean, Associate Dean for Management, School of Biomedical Informatics. Mr. Ryan Bean will now give the invocation. Please stand.
Please bow your head. Dear Lord, as we gather on this day of celebration, we invite you into our presence and ask your blessings on these proceedings. Today we celebrate the accomplishment of students who have learned and grown as they have longed for this moment. The accomplishment of families who've supported these graduates in a variety of ways. The accomplishments of professors who have demanded the best from their students in their care. And the accomplishments made possible by mentors who lead by example, by spouses who supported and encouraged, and by children who waited. As we look to the future, help us to remember how you have carried us to this point, and please be ever present in our future as we ask for your ongoing wisdom and guidance. In Jesus' name we pray, amen. Please be seated.
Thank you, Mr. Bean. Over the past year, a total of 82 SBMI students have completed their studies at the school, including 43 students earning a master's degree, 3 earning doctoral degree, and 36 earning graduate certificate. Today, 27 of the master's and doctoral students are here today to be honored. I know each of you will leave your mark on the informatics community, just as you have left your mark on the School of Biomedical Informatics and UTHealth. Remember that this school will continue to support you as you move forward in your professional careers. We look forward to hearing about the advancements you discover in the field of informatics that will better the state of healthcare across the globe. Our alumni hold leadership positions in prominent healthcare organizations through the Texas Medical Center and the leading universities, including Memorial Hermann Healthcare System, Emily Anderson Cancer Center, Harris Health, CHI St. Luke's, HCR Gulf Coast, at Duke University, and many others. I do not want to put any pressure on our latest group of graduates, but you know that our expectations are very high. As another year comes to a close, I want to reflect on the past and look forward to the future. I'm proud to tell you that our school is continuing its rapid growth. Our school student body has been more than doubled over the past 2 years. In addition to seeing a rapidly growing student population, our master's program is ranked among the nation's top 3 best online master's programs in healthcare informatics. And our tuitions and fees, both in-state and out-of-state, remain among the lowest in the nation. Quality, quantity, and affordability, our school excels in all 3. So I hope the healthcare industry can follow our footsteps to improve all 3 of them. Our faculty body has also been more than doubled over the past 3 years. Since last year, 9 faculty members have joined us already, and 4 will join us later this year. Among them, we have established scientists from Rochester, Vanderbilt, and the University of Alabama, Birmingham. Also young researchers from NIH, MIT, Stanford, Vanderbilt, and UTHealth. And also senior executives from Mcgovern Healthcare System, CHS St. Luke's, Greater Houston Connect, and U.S. Army. So together with the School of Public Health, we just made an offer yesterday to a young scientist from Harvard who has expressed a strong desire and interest in becoming a Texan. So we hope he will join us later this year. So with the doubling of faculty and student bodies, we have also seen a rapid growth of our postdocs, research assistants, programmers, and staff. One reason we are having our commencement ceremony here today at this location is that we have outgrown the auditorium at the Institute for Molecular Medicine. So when you come back to visit us in the near future, I'm sure you will see us at a different location again. Next year, we will celebrate the 20th birthday of our school on April 20th, which is also the birth date of our school's legendary founder and first dean, the late Doris L. Ross, who passed away on August 4th, 2015. She was a visionary in the field of informatics, and she recognized 19 years ago that informatics is the future before anybody else did it. She will always hold a place of honor here at this school, as her contributions to UTHealth and the School of Biomedical Informatics cannot be quantified. I want to challenge students we are here to celebrate. Like Dr. Doris Ross, work towards becoming pioneers. Seek out problems that others believe have no solution and find the answer. Continuously use information at your disposal in a unique and profound way. Ultimately, I challenge you to work tirelessly to make healthcare safer, better, and more efficient for both clinicians and patients around the world. Again, I want to thank each of you for joining us today to celebrate the achievements of these outstanding graduates. Please join me in applauding our graduates. Thank you. Let's continue our ceremony as I introduce Adriana Rubio, the 2015-2016 president of SBMI Student Governance Organization. Adriana will present both the Paul C. Boyle Award for Student Research and the John P. Mcgovern Outstanding Teacher Award.
Thank you, Ding Zhang. The John P. Mcgovern Outstanding Teacher Award is presented each academic year to an educator from each of the University of Texas Health Science Center at Houston component schools. The faculty member who earns the award embodies excellence in teaching. 2 faculty members were nominated by my peers this year, and I would like to recognize those faculty nominees now. I ask that both nominees stand when their name is called as you recognize their accomplishment. The nominees are Dr. Sahidi Mainini and Dr. Kui Tao. Please join me in congratulating them both. Thank you, nominees. Please be seated. In submitting their nominations, students were asked to evaluate each faculty member on the following criteria: excellence in teaching based on knowledge of the subject, interest and enthusiasm for teaching, understanding of students, responsiveness to student inquiries, encouragement of independent thinking, and accessibility to students. Once again, I want to congratulate our nominees and thank them for their contributions to our school. The winner of the 2016 John P. Mcgovern Outstanding Teaching Award for the School of Biomedical Informatics is Dr. Sahidi Mainini. Please come to the stage.
Thank you all for this great honor. I'd like to take a moment to thank my colleagues, my students for nominating me and selecting me as the best teacher. So I'd like to take a moment to just think upon who have influenced me to be here. All my mentors throughout my schooling, college, and grad school have all imbibed in me great interactive learning opportunities and values which I'm trying to pass on to my students. And it's those people, all my mentors, who brought me here, and I would like to take a moment to thank them all. Thank you.
Now, I want to recognize the outstanding student research efforts of an SBMI student through the Paul C. Boyle Award for Excellence in Student Research. This award is given to an individual or first author in student informatics research. A judging panel composed of SBMI alumni, advisory council members, students, or faculty determine the winner. These individuals judge all school poster session projects during an academic year. The recipient of the Paul C. Boyle Award for Excellence in Student Research for the fall 2015 semester was Tom Aguntuga for his poster titled Opinion Mining of Clinician Notes, an Exploratory Study. Join me in congratulating Tom. The recipient of the Paul C. Boyle Award for Excellence in Student Research for the spring 2016 semester is Rajani Pinamaneni for his poster titled Developing a Clinician Decision Support Tool to Support the Family-Centered Care in PICU. Rajani is one of the graduates we are here to celebrate. So Rajani, please stand and let's all give him a round of applause.
Thank you, Adriana. Your work as president of Student Governance Organization is greatly appreciated. At this time, I want to introduce SBMI alumnus, adjunct faculty member, and Alumni Association President-elect, Dr. Ado Escobar, who will present SBMI's 2016 Distinguished Alum Award.
Thank you, Dr. Shank. And good afternoon to everyone today. The UTHealth School of Biomedical Informatics Alumni Association was established as an important arm of SBMI to support our rapidly growing alumni population. As well as a member of the SBMI Alumni Association, each graduate who walks today will serve as an ambassador for our school and the field of informatics. While we are celebrating your achievements today, graduates, let us also celebrate the outstanding informatics contributions made by another SBMI alumnus, Dr. Carl Varshan, the winner of the 2016 SBMI Distinguished Alumnus Award. Dr. Varshan was born, raised, and educated in Brooklyn, New York. He studied at City University of New York, Brooklyn College for his undergraduate education and attended State University of New York, Downstate Medical School to earn his medical doctorate in 1979. Here are two little-known facts about Dr. Varshan. He entered college after his junior year and never earned a high school diploma. He then was accepted to medical school after his junior year and never earned a college degree. Clearly, Dr. Varshan has always been an achiever. After medical school, he then went to Ohio to complete his internship and residency in internal medicine at Cleveland Metropolitan General Hospital and his fellowship in infectious disease at University Hospital of Cleveland. He did not land in Houston until 1984 when he began working in private practice at the Infectious Disease Consultants. He continued working with the practice until 2008. During that time, Dr. Varshan worked at the various Texas Medical Center institutions, including UTHealth, Memorial Hermann, and Baylor College of Medicine. In 2013, Dr. Varshan earned his master's degree in health informatics from SBMI. During that same year, he was named Chief Medical Information Officer of the Houston-based Health Network HCA Gulf Coast Division and Chief Medical Information Officer of HCA's Bayshore Medical Center in Pasadena. In his role, Dr. Varshan is essential to the implementation of the clinical information technology initiatives for the Gulf Coast Division. He also acts as go-between for the organization's physicians and the health IT tool they use. As an infectious disease doctor and health IT advocate, Dr. Varshan is a member of several prestigious societies and associations, including the American Medical Informatics Association, the American College of Physician Executives, the Infectious Disease Society of America, and the American College of Physicians. No matter what role he has served, advancing patient safety has always been at the forefront of his mind. Dr. Varshan is also an adjunct assistant professor at SBMI and an active member of the school's advisory council. In addition, Dr. Varshan and his wife had made a pledge for the creation of the Dr. and Mrs. Carl V. Varshan Professorship in Informatics. Dr. Varshan has truly lived the SBMI experience at all levels and continuously plays an influential role in the advancement of our school and its goals. I ask you all to join me in congratulating Dr. Carl Varshan, winner of the 2016 SBMI Distinguished Alumni Award. Unfortunately, Dr. Varshan is speaking at an informatics conference in Minnesota today and could not be here with us today, but he previously prepared some words to demonstrate his thanks and gratitude.
Hi, thanks very much for this amazing award. I want to thank the Alumni Association, of course, Dean Zhang, and all of the faculty and students who are here at the graduation ceremony. I started at SBMI back when it was still the School of Health Information Sciences back in 2009 at the age of 52. So I was one of the older graduate students they probably had at the school. But this was actually a second or a third career for me after having been in clinical medicine for 24 years practicing infectious diseases here in Houston. I had left private practice and had joined the Hospital Corporation of America, HCA, as a chief medical officer within hospitals and realized very early on that I needed to learn a lot more about health information technology. Meaningful use had been announced. It was up and coming. We were going to be implementing inpatient CPOE and documentation within our hospitals. And I thought I would just take a few courses, get a certificate degree perhaps. But once I got into the school and realized the incredible depth of what I did not know about informatics and how fascinating some of the areas were, decided to switch gears a little bit and go for the full master's degree, and was able to complete that while still working full time. So I think that's one of the beauties of SBMI, is I was able to do some online courses and actually be able to do this on my own time. This has been an amazing collaboration with the school. I've made a lot of great contacts, and I'm actually not able to be at the ceremony today because Professor Dean Sittig and I are going to be on a panel discussion in Minneapolis at the 2016 iHealth meeting, something which I would never have been able to participate in had I not been a student at SBMI and actually worked with Dean on a couple of projects and, of course, in a few of his courses. So this is something that I enjoy doing. I think lifelong learning is really the only way to go, especially in information technology. It's changing so rapidly that although you may think you've graduated from the school, if you don't really keep up with what's going on in the outside world and what's emerging as new knowledge, you're going to be left behind very quickly. So once again, thanks very much for this award. I cherish it very much. And once again, welcome from Minneapolis.
Although Dr. Varshan cannot attend the ceremony today, and let's give him another round of applause for the extensive contribution he has made to our school. At this time, I'm honored to introduce our commencement speaker for this afternoon, Dr. John Halamka. Dr. Halamka is the International Healthcare Innovation Professor at Harvard Medical School, Chief Information Officer of the Beth Israel Deaconess System, and a practicing emergency physician. At Beth Israel, he is responsible for all clinical, financial, administrative, and academic information technology, serving 3,000 doctors, 14,000 employees, and 3 million patients. Dr. Halamka is an ex-officio and former co-chair of the National Health Information Technology Standards Committee. As co-chair of HID Standards Committee, he facilitated the process of electronic standards harmonization among stakeholders nationwide. In 2015, he was the recipient of the American Medical Informatics Association's Don Detmer Award for Health Policy Contribution in Informatics. Dr. Halamka earned 2 undergraduate degrees from Stanford University in 1984, one in medical microbiology and another in public policy. While at the University of California, San Francisco, he was a student in the medical science training program and earned his MD in 1993. He completed both his internship and residency in emergency medicine at Harbor UCLA Medical Center in Los Angeles. In 1997, Dr. Halamka was awarded a degree in medical informatics from the Harvard MIT program in health sciences and technology. He participated in the Harvard School of Public Health Clinical Effectiveness Program in 1997 and was accorded an honorary Master's of Science from Harvard University in 2011. Dr. Halamka strives to improve healthcare quality, safety, and efficiency for patients, providers, payers throughout the world using information technology. Dr. Halamka has written 5 books, including 1 fiction book about health IT. Fifth Domain, I strongly recommend read it if you haven't read it yet. He also authored several hundred articles and the popular Geek Doctor blog. In addition to his work in health informatics, he is also an organic farmer in Sherborne, Massachusetts, overseeing 15 acres of agricultural, animals, and cider meat making, and of course beer. Let's give a welcome to Dr. John Halamka.
So, looking out at you, how many of you are carrying with you a device like this? I bet a fair number of you. Well, let me tell you a true story. My wife, who by the way agrees that I can share her medical history, no privacy issues, it's okay, about a month ago came to me and said, I have had 20 pounds of weight loss I did not expect. My heart rate is very fast, and some of my eyebrow hair is falling out. Now, for the fine doctors who are sitting behind me, you know I have just described the symptoms of hyperthyroidism. Her thyroid is basically putting out so much hormone, it's like her body is on speed. And so what did she do? Did she get in a car and drive 40 minutes down to a downtown academic medical center for the right to pay $30 to park, wait for a few hours to see Dr. Famous? No. She picked up this device and she did a secure message to her primary care physician saying, I believe I have hyperthyroidism and I believe I should have a test at a local lab. Well, her primary care physician received the message, it was all secure, and ordered that test at a local Quest laboratory 5 minutes from our home. So my wife, 5 minutes later, is in Quest getting a TSH, a T3, and T4 drawn. And Quest has a program by which the patient will get the lab results sent to their phone. It's your data, right? There's no HIPAA issue with sending you your own data. So 2 hours later, she discovers, yes, she has hyperthyroidism. Her T3 and T4 are high, her TSH is 0. It's a bad thyroid problem. So she then texts her primary care doctor. I think I need referral to an endocrinologist. I have a thyroid problem. So the primary care doctor on her phone does a referral. The endocrinologist happens to, in our 450 locations of care, have an office that's about 10 minutes from our house, and it just turned out the next day had an appointment available. She goes to see the endocrinologist, one more test is done. She gets the result of that test on her phone. The diagnosis is made, she has Graves' disease, kind of an autoimmune problem, causes your thyroid to produce too much hormone. The endocrinologist prescribes on her phone methimazole, a medication that is used to treat hyperthyroidism, to Walgreens, which is next to our farm. And so my wife walks down to Walgreens, picks up the medication, 10 milligrams today. A few weeks later, she's cured, things are fine. So what I've just described to you is the workflow that every one of us want. We don't want phone and fax and driving and parking. We want to, of course, see doctors in person when appropriate. But we don't really want to stand in line. We really want to just say, hey, when I can have a virtual visit and do it on my phone securely, and it's according to my preferences, and it's safe and convenient, that's good. So from the informatics perspective, what I've just described, the technology is all here. But there's a famous author, William Gibson, kind of the father of cyberpunk, who said, the future is already here, it's just not evenly distributed. So we're not quite in medicine ready to declare that this is the way that doctors and patients will work in the future. Again, it's up to you guys to make that happen. The technology is here, and I would venture a guess that many of you, all patients, are kind of willing to have that workflow. Another example for you. My health is very boring. I've had Lyme disease 3 times, I have glaucoma, nothing very exciting. A few months ago, I took my blood pressure, which has been normally 100/50, very boring, and it was 170/100. And my doctor said, it's one of 3 things. That commute on the Mass Turnpike is really bothering you. Same problem that Houston has, I think. You're drinking too much green tea, or your boss is just really nasty. But I'm not sure which of the 3 it is. And so, of course, the problem is we go to a doctor's office, they measure our blood pressure, it's one point in time. You have to measure your blood pressure before and after your commute, before and after your green tea, and before and after a meeting with your boss. And of course, I went on to Amazon.com, got an electronic blood pressure cuff with Bluetooth that communicates the blood pressure to my phone. I was able within one day to discover Actually, the commute's not so bad, the green tea's okay, and my boss is actually a nice guy. But I couldn't have done that unless I had Amazon, a Bluetooth blood pressure cuff, and my phone. And so, in fact, my doctor determined the problem was my parents, who both have high blood pressure, and gave it to me. You can't choose your parents, alas. A final example for you. My mother broke her hip 2 years ago. Now, they, at this fine hospital in Southern California, have a meaningful use, certified, extraordinary electronic health record. But they weren't able to connect to her primary care doctor's office 2 miles away. So the emergency physician, and I'm an emergency physician, guy did the right thing, said, bring in that paper bag of every plastic pill bottle you can find in the house. And any of you who've been on the receiving end of this, you know what I mean. The patient dumps the bag of all the empty plastic bottles, and my mother said, well, I take the red one, the green one, and sometimes the blue one. Unclear what she took. So using that full electronic health record, that doctor beautifully reconciled every medication she had ever been prescribed since 1982. When I got to Los Angeles, she was on 22 different medications, sitting in a corner, mumbling, completely unaware of person, place, or situation. No human being should ever be put on 22 medications simultaneously. And why did this happen? I mean, they were using modern, certified technology, but yet it wasn't a technological problem. It was a political problem, that 2 miles away, the doctor and the hospital weren't talking to each other. So we're now at a stage where we have this perfect storm. The technology is in the hands of every patient. There is federal government regulation that is helping us get beyond these political and organizational barriers. And there's a will to start sharing data and truly bringing medicine into the 2016 era. Some of our IT systems today are state-of-the-art for 1998. We have not caught up to retail. We have not caught up to banking. And it's these guys who are going to ensure we do. So I'll leave you with this thought. Some of us are doctors. All of us are patients. I believe we'll see in the next couple of years disruptive breakthrough innovation that is going to empower all of you to be the stewards of your own healthcare. We'll engage families. We'll share data. In fact, you will contribute much of the data to the record yourself. You'll have devices in your homes, and we'll be able to share that information that helps empower the care that you receive. And as an example of that, again, my wife's okay with this. She had breast cancer, stage 3A, diagnosed in December of 2011. Because she had the benefit of the experience of other patients like her who had come before her, we were able to choose the right medications for her to be treated. We were also able to learn about the side effects and the problems, and we were able to dose her medications appropriately so that she would get cure without long-lasting side effects. And it all worked. So as these guys build the next solutions of the future, keep in mind they'll empower you. And then in turn, it is your job to empower others. Share your data, contribute it to research, contribute it to clinical trials, and be part of essentially a social network for wellness. And that is the future, the perfect storm we are all entering. So I am 54 years old. I am now at the point in my life where I am not the disruptive innovator. I am the establishment. The future belongs to these guys. So the world is your oyster. Grab the brass ring and build the innovative solutions we all need. Thanks very much.
Thank you so much. So now we will recognize our 2016 graduates. I would like to ask all candidates for the degree of Doctor of Philosophy in Health Informatics and candidates for the degree of Masters of Science in Health Informatics at the University of Texas Health Center, Houston School of Biomedical Informatics to please rise. President Carter, on behalf of the faculty of the UTHealth School of Biomedical Informatics, it's my pleasure to certify to you that the graduates who stand before you have successfully completed all academic requirements for either the degree of Doctor of Philosophy in Health Informatics or the degree of Master of Science in Health Informatics.
By virtue of the authority vested by the State of Texas Board of Regents of the University of Texas System and delegated by them to me, I now confer upon each of you the degree of Doctor of Philosophy in Health Informatics and the degree of Master of Science in Health Informatics, for which you have been recommended with all rights, privileges, responsibility, and obligation. So graduates, thank you for trusting UTHealth with your education, and congratulations to you and your families.
We will now have Dr. Susan Fenton to call forth all the graduates.
Will the master's students please come forward as your name is called? Adlai Arundella. Faculty Advisor, Dr. Kimberly Smith, Capstone Project, Workflow Analysis of Ben Taub Hospital's Clinical Processes. Althorpe Ross Arundella. Faculty Advisor, Dr. Kimberly Smith, Capstone Project, Workflow Process Analysis and Redesign to improve system interoperability, communication, and coordination between different user roles in the Ben Taub operating room. Preston A. Cox. Faculty Advisor, Dr. Juliana Brixey, Capstone Project, a public health informatics study of gonorrhea incidents in Houston, Harris County. Evan Paul Bernard. Faculty Advisor, Dr. Yang Gong, State of the Science paper, an analysis of information system integration in the Ebola crisis. Eric Bigelow. Faculty Advisor, Dr. Sahidi Mainini, State of the Science, Analysis of Sequencing Data Visualization in Public Health Literacy and Knowledge Retention. Vanessa Bianca Buckley. Faculty Advisor, Dr. Juliana Brixey, Capstone Project, Practicum in User Interface Design. Devi Das. Faculty Advisor, Dr. Amy Franklin. Capstone Project, Role of Health Informatics in Infectious Disease Surveillance. Debbie was a Spring 2016 recipient of a Doris L. Ross Scholarship. Kathy DeFigueiredo. Faculty Advisor, Dr. Kimberly Smith. State of the Science paper, The Multifaceted Impacts of Electronic Medical Record Usability. Angel Guevara. Faculty Advisor, Dr. Robert Vogler. Capstone Project, the analysis, evaluation, and implementation of data migration from Syed Evita Score MD software to WellCentive Analytics tool. Angel was a Spring 2016 recipient of a Doris L. Ross Scholarship. Lindsay LaRue Hadfield. Faculty Advisor, Dr. Yang Gong. Capstone Project, Evaluation and Optimization of Clinical Decision Support System for the Prevention of Thrombocytopenia. David Hebert. Faculty Advisor, Dr. Susan Fenton. Capstone Project, Interoperability, Health Information, and Image Exchange. Kevin Liunga. Faculty Advisor, Dr. Yang Gong. Capstone Project, The Current and Future Trends of Business Intelligence Solutions. Vidya Narayana. Faculty Advisor, Dr. Todd Johnson. Capstone Project, Challenges of Finding, Assessing, and Accessing Biomedical Data Sets. Grace Julia Okoroji. Faculty Advisor, Dr. Dean Sittig. Capstone Project, A Clinician's Guide to Safe, Effective HIT Integration in Behavioral Healthcare Settings, a systematic review of where we are and what's feasible. Keyordi Olupinur. Faculty Advisor, Dr. Dean Sittig. Capstone Project, Case Report of the EPIC Vincino Laboratory Interface Development in Harris Health System. Rajani Pinamanini. Faculty Advisor, Dr. Trevor Cohen. Capstone Project, Developing a Clinical Decision Support Tool to Support Family-Centered Care in the PICU. Rajani was a Spring 2016 recipient of a Doris L. Ross Scholarship. Nicholas Poole. Faculty Advisor, Dr. Shui Tao. State of the Science paper, utilizing big data methodologies to establish positive patient outcomes. Nina Salimi. Faculty Advisor, Dr. Dean Sittig. State of the Science paper, Field Testing of Safer Guides, Self-Assessment Guides for EHR Safety. Nina was a spring 2016 recipient of a Doris L. Ross Scholarship. Hugh Song. Faculty Advisor, Dr. Susan Fenton. Group Capstone Project, Trauma and Joint Surgery, New Opportunities for Absorbable IVC Filter Replacement. Hugh was a fall 2016 recipient of a Doris L. Ross Scholarship. Kimberly Spirison. Faculty Advisor, Dr. Susan Fenton. State of the Science, Analysis of Evolving Health Technology, Health Information Management, and its Impact on Spinal Cord Injury Treatment. Lillian Torcios. Faculty Advisor, Dr. Susan Fenton. Capstone Project, Environmental Health Inspection Software Enhancement Project for Local Public Health. Mary Regina Wysocki. Faculty Advisor, Dr. Juliana Brixey. Capstone Project, Identifying Acute MI Patients via an Embedded EHR Quality Measure. Sharon Francine Young. Faculty Advisor, Dr. Juliana Brixey. Capstone Project, Evaluation and Participation in Harris Health IT Service Management Projects. Will the doctoral students please come forward as your name is called? Will the faculty advisors for Joshua Caleb Goodwin please come to the stage? Joshua Caleb Goodwin. Faculty Mentor, Dr. Elmer Bernstam. Additional faculty advisors, Dr. Todd Johnson, Dr. Trevor Cohen, and Dr. Thomas Reinfleisch. Dissertation title, Implications of Computational Cognitive Models for Information Retrieval. Will the faculty advisors for Claire Lowe please come to the stage? Claire Lowe. Faculty mentor, Dr. Amy Franklin. Additional faculty advisors, Dr. Trevor Cohen, Dr. Maria Fernandez, and Dr. Jiaji Zhang. Dissertation title, Designing for Practice Development in a Social Learning System, Communicating Norms and Vicarious Experience. During her tenure at SBMI, Claire was a Schull Institute Fellow from 2009 to 2015. Will the faculty advisors for Diwagar Rogeeth please come to the stage? Diwagar Rogeeth. Faculty mentor, Dr. Jiaji Zhang. Additional faculty advisors, Dr. Amy Franklin, Dr. Elmer Bernstam, Dr. Shuram Iyengar, and Dr. Mohammed Walji. Dissertation title, Process Mining of Medication Revisions in Electronic Health Records. Congratulations, new alumni. We celebrate your achievements and those of the following SBMI graduates who could not attend the commencement ceremony today. Our summer 2015 master's graduates, Kavus Ilami, Shivam Pandey. Fall master's graduates, Brian Dawson, Oscar Gonzalez, Benita Harris, Scott Kramer, Chwakwuma Okiki, Sawananda Pandit. Spring master's graduates, Nabil Ajina, Amir Alu-Matari, Mark Diamatio, Christopher Felton, Gail Olin, Navdeep Pal, Mishero Serbo, and Rafiq Youssef. Please give a round of applause for all of our graduates as we recognize their accomplishments this afternoon.
Okay, graduates, you may now move your tester from the right to the left. Congratulations. At this time, I would like to ask all School of Biomedical Informatics faculty and adjunct faculty to rise. We thank each of you for your dedication to educating today's graduates. I would like to invite all family members and friends of our graduates to stand. Our graduates would not be where they are today without your support, guidance, and love. While you are not walking the stage today, we want to recognize you for your tremendous contributions. Thank you. I want to thank the special guests who joined us today, Dr. Halamka, Dr. Cardosoto, Dr. Blackburn, and Dr. Stanzo. We truly appreciate your participation in today's commencement ceremony. I want to also thank the staff of the School of Biomedical Informatics. You have worked so hard to make this ceremony a success. Also to our students and alumni, without you, we would not be here to celebrate this happy occasion, and we want to recognize all of you as well. We now conclude our commencement ceremony, and we invite all of you to join us for the reception. Thank you so much.